Lucas Bayer was active in his church youth group. He worked part-time as a swim instructor and played high school football in this quiet community outside Seattle. But when the 16-year-old hurt his back, his mother, Olga Davidov Bayer, says he started taking painkillers. She wasn't overly worried at first, but says she made sure to discuss drug risks after one of Lucas's classmates died of an overdose.
I talked to Lucas after funeral, even though I had no idea that Lucas buy pills. But I talked to him and I say, Lucas, I don't know what it is, because nobody was still saying about fentanyl. The people were still saying about pills. It was not clear. But I said, I want to make sure that I'm not mom who loses a child.
1 month later, investigators said Lucas took what he thought was Percocet, a powerful painkiller. It was a counterfeit pill laced with fentanyl. His mother found him unresponsive on the first morning of the new school year.
Then I heard that from his friends, it must be fentanyl. And then I started hearing, I'm like, what is fentanyl?
Pharmaceutical fentanyl is approved for treating severe pain. Illicit fentanyl is often mixed with heroin or cocaine or used in counterfeit pills like the one that killed Lucas. U.S. Drug Enforcement Agent Jacob Galvin says lab tests reveal potentially lethal fentanyl doses in 6 out of 10 fake pills.
We show it to our agents, they can't tell the difference. We show it to our laboratory people, they can't tell the difference. That's how good these things are made.
I honestly can think it can happen to anyone, because I think that the profit is huge for fentanyl, and I think that even if fentanyl can be dropped in anything. Just everyone needs to be aware that, well, there is things that is sold or distributed on the street.
Since the death in this community, there are new school programs about the dangers of fentanyl and drug kits with naloxone to help staff treat accidental overdoses.
We think the earliest we can get to a school, the better. We would be in grammar schools all the way up to colleges if they would have us, because that's how important it is to get the message out of how deadly these pills are.
The U.S. Department of Health and Human Services says that more than 90% of people 12 and older with a substance abuse disorder receive no treatment. Lucas's family created a volunteer group to spread awareness about fentanyl risks, help families recognize warning signs, and know where to turn for help. Natasha, Mozgovaya, VOA News, Sammamish, Washington.